Okay, guys. So I'll try my best explaining these heart murmurs. I used to have a problem with it in the past, but with some mnemonics and most of them from Dr. Nandan Joshi on YouTube, it helps and it became so easy. So I'll share them with you. So starting with the heart murmurs, we have to know that there is systolic, diastolic, and continuous murmurs. Okay, how to differentiate that this one is systolic and diastolic? You have to understand when does the valve open or close, and what occurs when there is a problem with the opening and closure. With the problem is with closure is the regurgitation, and the opening is the stenosis. So for example, let's say aortic regurgitation, that's the aortic closure problem. Okay, when does the aorta close? During diastole, of course not during systole, because during diastole the aorta should close and the mitral should open, and this is like simple physiology. The mitral should open so the left ventricle would fill. And the same thing with mitral stenosis. Stenosis, we said it is during the failure of opening of the valve. So when does the mitral should open? When should the mitral be opened? And during diastole. Okay, so when there is a problem with mitral opening, it's stenosis during diastole. So, and another way to remember it fast, instead of like wasting these seconds in the exam, that would mean a lot. You just remember that AR, like AR, aortic regurgitation should be the assault rifle. So assault rifle, die. Okay, and MS is the MS Microsoft system will die. So this is a very stupid mnemonic, but it saves time, saves second. The exam is very important. Okay, so AR, die, MS Microsoft, die. Let's go to the systolic murmurs. Starting with the aortic stenosis, I remember it like that. The A for aortic stenosis, the S is small. Okay, the A, remember the crescendo decrescendo murmur with the A, the crescendo decrescendo murmur. And the S, it is small s, so it's soft. It's soft. See, this is the S. It is soft, and it goes to the base, down to the base. So it is heard best at the base of the heart. Okay, loudest at the heart base. And another thing is that I remember that there's a car going down this loop. So car for carotid radiates to the carotid. Okay, and it goes down, and then I don't know what happens, and it's sad. So syncope, angina, and dyspnea. So this is the full mnemonic. It's so easy, but it will make all of this hard stuff easy, alhamdulillah. So crescendo decrescendo ejection murmur, soft S2, ejection click, maybe present left ventricle, where left ventricular pressure will be more than the aortic pressure during systole. Allows the heart radiate to carotid pulses parvus aortus, weak pulses with delayed peak, can lead to syncope, angina, dyspnea, and exertion. Sad, most commonly due to age-related calcification on older patients and younger patients with early onset calcification of bicuspid aortic valve. Okay, so this was the aortic stenosis. You have to remember the car, carotid, goes to the base of the heart. So base, S2 is small, soft, ascending, crescendo, decrescendo, soft S2, and it's sad. And what else? Pulses parvus aortus, it arrived, let's say the car arrived late, so, and it's weak, so weak and late pulses, and early onset calcification. Okay, the mitral tricuspid regurgitation is so easy. It's like the mitral tricuspid holosystolic, along with the VSD. Both of them are holosystolic, and the mitral will be at the mitral area, the tricuspid will be tricuspid area. Tricuspid is due to tricuspid dilation, and which is the right ventricular dilation. The mitral will be left ventricular dilation, but the mitral will also have the mitral valve prolapse and the post MI. That's the difference, and that's all about the mitral and tricuspid regurgitation. high pitched blowing murmur. Okay, holosystolic high pitched blowing murmur. Mitral loudest at the apex, reduced towards the axilla. Okay, ischemic heart disease, mitral area, which is the apex. Okay, and tricuspid area caused by right ventricular dilation. Rheumatic fever and infective endocarditis can cause either mitral regurg or tricuspid regurg. So the rheumatic fever and infective endocarditis can cause both. Mitral valve prolapse is so easy. So looking at all the murmurs, all of them has two words like aortic stenosis, tricuspid regurg, mitral regurg. Except for VSD, but VSD is easy. We know that it's holosystolic murmur, and BDA, of course, we know it patent machine-like murmur. So yeah, and AR, aortic regurg, mitral stenosis. So all of them, except for the ones that we know that they are continuous or holosystolic, all of them has two words. But the mitral valve prolapse has three words. Okay, so 3 has a word in the middle, so it has mid systolic click. 3 words, mid systolic click. Okay, and after the click it will go up crescendo. Okay, and the mid systolic click, after the click the sound will start, so the sound is late systolic, late, and it's crescendo, so late crescendo, late crescendo systolic murmur. So it's late systolic crescendo murmur with mid systolic click due to sudden tensing of the chorda tendineae. Okay, so during contraction of the ventricle, this valve should close like that, but it's prolapsed, so it will go up, and going up it will have to be pulled by the chorda tendineae, and it will create that tensing. This sudden tension of the chorda will create the mid-systolic click. Okay, yeah, that's all. Best heard, and it's mitral. Whenever there is mitral, it's the apex. Mitral, so it's heard at the apex. Mitral leaflet prolapse into the left cornicus. Best heard over the apex. Loudest just before S2. Yeah, loudest just before S2. Usually benign, can predispose to infective endocarditis, can be caused by myxomatous degeneration, primary and secondary connective tissue disease, Marfan, Ehlers-Danlos syndrome, rheumatic fever, particularly in developing countries, chorda rupture. Then the VSD is so easy, holosystolic, harsh sounding murmur, loudest as tricuspid area. Tricuspid, like VSD and the tricuspid regurg, they are the same, like tricuspid area. Okay, large VSD have low intensity murmur than small VSD, of course, because large VSD you have enough space for the blood to flow, so the murmur will be low. Small VSD, small area, loud murmur. Then we'll go to the diastolic murmurs, which are DI-AR, and mitral stenosis, which is the Microsoft Woodard, Microsoft system. Okay, the aortic regurg is a high-pitched blowing early diastolic decrescendo murmur. Okay, so I remember it. The aortic regurg AR for assault rifle. Okay, assault rifle. So the rifle will blow the head of a bear. Okay, and assault rifle we also have pistol shot, like everything is aggressive. Yes, shot. Okay, so AR for assault rifle, blow the head, so it is high pitched blowing murmur, head for head popping or Demus sign, and the bear for the causes which are blah 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 blah, and the pistol shot for the femoral brachiofemoral delay, I guess. Wide pulse pressure, yeah, head popping. Okay, let's read it. High pitched blowing for the blow, high pitched blowing, early diastolic decrescendo. Yeah, they are diastolic, both of them. One is early and one is the other one is what, a bit later. Okay, delayed. One is early, one is delayed. Okay, best heard at the base, aortic dilation, or left sternal border valvular disease. Long diastolic murmur, hyperdynamic pulse, and head popping. Long diastolic murmur, hyperdynamic pulse. Yeah, this is the hyperdynamic pulse, the pistol shot. Okay, and head popping when severe and chronic. Wide pulse pressure. Okay, pistol shot. Causes include bicuspid aortic valve for the B, E for endocarditis, A for aortic dilation, R for rheumatic fever, progress to left heart failure. Following, okay, that's it about the aortic regurgitation. See how easy is it? So easy, so clean, everything is perfect. Life is amazing. So mitral stenosis, MS for the Microsoft, and it's an operating system. So operating system for opening snap. O system, operating system, opening snap. Okay, so it has an opening snap. It follows opening snap due to abrupt hold in leaflet motion in diastole after rapid opening due to fusion of the leaflet tips. This one is so easy. So here's the valve. Okay, when it opens, there is stenosis opening, and then after opening there will be like the snap due to the stenosis, abrupt hold in leaflet motion. Okay, so whenever this snap is closure, or the closer this snap to the S2, the worse the condition. Following opening snap due to abrupt hold in leaflet motion distal after rapid opening due to fusion at the leaflet tip. Yeah, as I told you here, fusion at the leaflet tip and opening, then they will pull and the snap will occur. Delayed rumbling mid to late diastolic murmur. Decreased interval between the S2 and OS correlates with severity, left atrial more than left ventricular pressure during diastole. Often alliate and highly specific, sequel of rheumatic fever. Chronic MS can result in pulmonary congestion, hypertension, left atrial dilation, atrial fibrillation, and Ortner syndrome. Okay. Patent ductus arteriosus. Continuous machine-like murmur, best heard at the left interventricular area, loudest at S2, often due to congenital rubella or prematurity. You need a patent for that machine. This one is so easy, like they already have a good mnemonic here. And yeah, this covered these things. S2 is the aortic, has two components, the aortic and pulmonary. Base heard at the left upper sternal border, tricuspid area lower portion of the sternal body. That's all. Hope it was helpful. Let's clean all this mess. If you needed anything, let me know. Good luck, good luck, good luck, good luck. Bye, 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 bye.